Hello, Mr. Fleming. My name is Parker. I'll be your nurse for today. I was just coming in to do a head-to-toe assessment on you. Is that all right?
Yes.
Alrighty. Would you be able to verify your name and date of birth for me? I'm just going to check your wristband here.
Ryan Fleming, 5/12/76.
Okay. And can you tell me what today's date is?
May 24th.
Okay. And do you know where you're at right now?
Doctor's office.
Alright. So the patient is alert and oriented ×3. Their appearance is appropriate for time and place, and their hygiene is in good condition. So now I'm just going to go ahead and inspect your head and hair and just make sure everything looks good up there, okay?
Yes.
Alrighty. So there's no lesions or abnormalities present on the skull. I'm going to go ahead and test cranial nerve 5. Can you go ahead and close your eyes for me? And then if you feel a touch anywhere on your face, just tell me where it is, okay?
Cheek. Forehead. Cheek.
Okay, so cranial nerve 5 is intact. I am also going to test cranial nerve 7. You can open up your eyes now. Can you go ahead and make a smile for me? What about a frown? Alright, so cranial nerve 7 is also intact. I'm going to go ahead and move now to the nose. Can I have you look up slightly for me? Okay. There are no lesions to the nose. There's symmetrical, no septum deviation. Alrighty, sir, and we're also going to test cranial nerve 1 now. Can you go ahead and smell this for me and tell me if you smell anything?
Vanilla.
Alright, that is a vanilla scented chapstick, so cranial nerve 1 is intact. Now we're going to move on to the eyes, okay? So can you just look at the wall over there for me? I'm going to go ahead and shine this light into your eyes. Okay, wonderful. And then just go ahead and follow this pen light for me, okay? And follow it with your eyes, do not move your head, okay? Okay, wonderful. And then I'm going to bring it to your nose. Just follow it all the way with your eyes. Alrighty. So cranial nerve 2, 3, 4, and 6 are all intact. I'm going to go ahead and move now to your ears. Pupils are equal, round, react to light, and accommodate. So now we're going to go ahead and move to the ears. I'm just going to go ahead and inspect by pulling the pinna up and back. There are no lesions and the tympanic membrane is intact. Now I'm going to go ahead and have you close your eyes and look forward and just let me know if you hear any sounds, okay?
Okay. Yes.
Okay, now the other side.
Yes.
Alright, so cranial nerve 8 is intact. We're now going to move to the mouth, okay? Can I have you open up nice and wide for me? Okay. There are no lesions. Mucous membranes look good. I'm going to have you turn your head down just a little bit towards me and kind of stick your tongue out a little bit. And then a little bit farther. Let's see that uvula. Tilt your head down a little bit more. Okay, and then can you say ah for me? Alright, cranial nerve 9 is intact. So now you have been talking with me, so cranial nerve 10 is also intact. I'm going to put my hand on the side of your cheek, and I just want you to give me some resistance with your tongue, okay? Wonderful. Wonderful. Okay, so cranial nerve 12 is intact. So now I'm just going to give you a little bit of resistance on your shoulders. I just want you to give me a nice shrug, okay? Wonderful. So cranial nerve 11 is also intact. So now I'm going to go ahead and move on to checking your lymph nodes, okay?
Yep.
So here we have the pre-auricular, the post-auricular, occipital, the submandibular, submental, tonsillar, the anterior cervical, the posterior cervical, and then can you go ahead and shrug your shoulders up a little bit for me? And the supraclaviculars. I did not feel any swelling. Alrighty, so now I'm going to go ahead and examine your chest, okay?
Yep.
So I would say it looks to be a 1-to-2 ratio of the thoracic ADT. I'm going to go ahead and inspect just to make sure you have no lesions or anything abnormal. A little bit of sunburn around the neck. I'm going to go ahead and take a listen to your lungs now, okay?
Yep.
So each time I move my stethoscope, just take a nice deep breath for me, okay?
Yep.
And can you lift this arm just a tad? Okay, now the other side. Okay, lung sounds are equal bilaterally. Can I go ahead and have you stand up and turn around 180 for me? Alrighty, and then same thing as the front. Okay, so there was a moderate rate, rhythm, and depth throughout. There's no use of accessory muscles and inhalation or expiration. I'm going to go ahead and spinal alignment is in line. There's no deviations. I'm going to go ahead and percuss on the angle of your spine here. Just tell me if you have any tenderness, okay?
Okay. No. No.
Oh, okay, wonderful. So there's no cosciovertebral angle tenderness. I'm going to go ahead and put the palmar surface of my hand next to your spine, and each time I move my hands, just repeat 99 for me, okay?
Okay. 99, 99, 99, 99, 99.
All right, so we did have equal vibrations bilaterally. So now we're going to go ahead and move on to heart sounds. So can I have you go ahead and take a seat for me again, please? Alrighty, so now I'm just going to take a listen to your heart sounds, okay?
Yep.
Okay. So in the mitral valve, in the second intercostal space, S1, S2 are heard. In the pulmonic valve, in S1, S2, or second intercostal space, S1 and S2 are heard. At Erb's point, in the third intercostal space, S1 and S2 are heard. At the tricuspid valve, in the fourth intercostal space, S1 and S2 are heard. And at the mitral valve, in the fifth intercostal space, S1 and S2 are heard. Okay, no abnormal heart sounds there. I'm going to take a listen to your carotid arteries in your neck now really quickly, okay?
Yep.
Okay, no abnormal sounds. Okay. No bruits were noted in the carotid arteries. So can you please turn over both wrists for me? Fantastic. Okay, +2 bilaterally in the radial pulse. Brachial pulses are also a +2. Now I'm going to go ahead and check your popliteal pulses behind your knees. Those are about a +2 as well. And now for the dorsalis pedis pulses. Can you turn and put your feet on the bed there? Alrighty. Now those are about a +1 bilaterally. Alrighty, sir. So that'll be all for your pulses. Now we're going to go ahead and move to the abdomen. Can you go ahead and lay down on the bed for me, please?
Yes.
Alrighty, so now we're going to inspect the abdomen. There's no lesions present. There's a protuberant shape to the abdomen. I'm going to go ahead and auscultate for bowel sounds now. And I'm going to start in the right lower quadrant and work in a clockwise fashion. Okay. Normal bowel sounds were noted. So now I'm gonna palpate for any tenderness. If you feel any pain or discomfort, just let me know, okay? Okay, no abnormalities in the abdomen. So now I'm going to go ahead and test the legs for range of motion and strength. I'm going to go ahead and lift up this leg here a little bit, and then I'm going to lift up, just give me some resistance. Okay, wonderful. And now I'm going to try and push down, just give me some resistance back. Wonderful. I'm going to try and push your foot up, give me resistance downward. Fantastic. And then the other way, your resistance upward, please. Fantastic. Now I'm going to test for ankle clonus right now. So I'm going to just loosen up your ankle for me and kind of let it go limp. I'm going to shake it vigorously for a second or two and then let it go, okay?
Yep.
Okay, no ankle clonus is present. I'm going to go ahead and have you sit up on the side of the bed for me, and then we'll do the same thing with your arms, okay? Alrighty, so I'm going to assess the arms for edema or any abnormalities. There is 0 edema noted, no deformities noted. I'm going to check the capillary refill on your both fingers and toes now. Okay. Alright, capillary refill is less than 3 seconds in both sites bilaterally. I'm going to go ahead and test your range of motion of your arms now, okay? Can you bring them straight out like a zombie for me? And then off to your side, above your head, and then back down to your side. Fantastic. Now, I'm going to go ahead and check your reflexes, okay? I'm going to go ahead and start with your arm. I'm just going to raise it out like this. And now we're going to test the brachial radialis. Okay, that's good. And now the bicep. Okay, tricep. All right, now we're going to move on to the patellar. That's not a shot. The Achilles. Down low, and the tibial. All right, all tendon reflexes are intact. Alrighty, sir, and then can I have you grasp my hands for me and then squeeze as hard as you can? Okay, wonderful. And then I'm going to have you stand up for me and close your eyes. I'm going to slightly push you in either direction. Just maintain balance for me, okay?
Mm-hmm.
Okay, balance is good. You can go ahead and take a seat now if you like. Is there anything I can do to help you get comfortable?
No, I'm good.
Alrighty, well, if there's anything you need, you just let me know, okay? I'm going to go wash my hands, and you have a nice day, sir, okay?
Thank you.
You're very welcome.